One of the big trends we're seeing in plastic surgery right now, especially in Salt Lake City, is implant plane selection. So should I put my implants in front of the muscle? I talk about this a couple of times every day. We can put implants in front of the muscle, which is a subfascial position. That's the modern way of talking about that, or in a subpectoral position, which is under the muscle. Generally, under the muscle is going to skew a little bit more natural. So my patients who say, listen, I want to look natural, but I want to be a little bit bigger, especially if I want to be at the pool and I don't want my mother-in-law necessarily to know, that's definitely going to be an under the muscle, because the pectoralis major muscle will drape over the upper border of the implant in a way that makes that takeoff angle of the upper border of the implant look less done, as they might say. In front of the muscle can also look very natural depending on body habitus. And for some people, it's just the right way to go all the time. However, in front of the muscle can skew a little bit more in the done spectrum of things, where the appearance is a little bit more round. And that's to say, the upper pole has a little bit less tissue to conceal it, so it can have a little bit of a sharper takeoff angle. It can look awesome that way, and it can look awesome under the muscle. It's not that one is better than the other, it just is about what kind of look are you going for.
Another hot topic in breast aesthetic surgery is meshes. So whether to use mesh or not, what kind of mesh to use. So there are a number of meshes that are out there in the world that we use in aesthetic surgery, from biologic meshes that are made of human skin or pig skin to absorbable meshes that are made up of a synthetic material that is similar to our sutures. So we can use these materials to do different things to help support the breast. So when we do breast reductions or breast lifts, we can use this mesh to help support the shape of the breast, to help create a longer shape for patients. We use the mesh to help support implants. If we have implants that are settling too low, shifting in the pocket, we can use the mesh to help support the implants, support the weight of the implants, what we call an internal bra. And then we also use mesh to help reduce risk for capsular contracture or intensifying scar tissue around an implant. We have certain meshes that are very good at reducing the scar tissue formation and capsular contracture. So we have the ability to really tailor the mesh towards the specific problem, whether we use certain meshes or not, to make sure that we really get the best results for the patients. So another hot topic is revision breast surgery for women. So women that have had implants in for 10, 15, 20 years, sometimes even 30 or 40 years, now's the time to start thinking about how you're going to manage that long term. So do you want to remove the implants? Do you want to replace the implants? When an implant's been in for greater than about 10 to 15 years, it is time to start thinking about when's the right time to remove that implant or replace that implant. These are not meant to be there forever. We provide really comprehensive consultations regarding breast care, where we go through all the different options for patients depending on what their specific issue is, whether it's implant moving around in the pocket, whether it's the implant sitting too low, whether it's the implant getting too tight with capsular contracture.
Implant plane selection, the use of Galaflex mesh perhaps, internal bras and things like that. Schedule a consultation. It doesn't take long. We can give you an honest appraisal of what the science says and what's on social media and what's best for you and the pros and cons, because some things are good for some and not good for others, and we want you to get whatever it is that is best for you.